So for anybody who says that Medicaid is the solution to health for poor people, they haven't seen this graph or this map. And this is a map of South Carolina. The same map exists for every other state. But what it is essentially is a map of all adults on Medicaid in South Carolina, and it takes a look at their relative health. And essentially we put together a basket of chronic diseases and said, depending on where you live, we're going to categorize you as red, white, or blue. Blue means you're healthier than the state average, much, much healthier. Red means you're much less healthy than the state average. And white means you're at about the state average. Now, what you can see here shouldn't surprise anybody in this room because we talk about this I-95 corridor a lot. There is a broad swath of deep, deep red, which means that these individuals are much, much less healthy than the rest of the state. And you see the blue areas, which again shouldn't surprise you because this is where a lot of the population lives, but also where there's a lot of good jobs and good education and so on. These are the places where people are most healthy. Now, remember, this map is of people with insurance. This map is people with Medicaid. And yet we see these gigantic disparities depending on where you live on your health. And so it's not insurance, it's not Medicaid that's making the difference in these people's health. It's something else. And so as we did this data with our own group over at USC, we started to ask the question, well, if it's not Medicaid that makes the difference in these people's health, what is it? And as we started to dig into it, lo and behold, somebody else, one of the nation's leading public health thinkers, really one of the world's leading public health thinkers up at University of Wisconsin, a guy named David Kindig, was actually doing a county-by-county study of what accounts for differences in mortality across the United States. And University of Wisconsin and Dr. Kindig had created what's called the county health rankings that takes a look at 30 or 40 different indicators, not just of health, but of economic status, of educational status, of family status in terms of single-parent households, a whole set of what are known as social determinants, but also a set of healthcare factors. And Dr. Kindig was able to collect these for every single county in the United States, and he asked a simple question: what seems to be most associated with different mortalities between the counties throughout the United States? And what he found really doesn't surprise a lot of public health people, but I think surprised a lot of other people, is that none, absolutely zero, of the medical care factors such as rates of primary care providers or preventable hospitalizations or percentage of people who were insured or uninsured predicted changes in male or female mortality. None of the medical care predictors. Well, what did? He said, well, while many people believe that individual behaviors in medical care are the primary reasons for declines in health, it really has to do primarily with the rate of children living in poverty, the income, the relative income of those in the county, and a percentage of a county's population with college education. So income and education are the two things which are the best predictors and the greatest drivers of good health. Not having a good education so you make better health choices, not having a good income so you can buy insurance, those things didn't matter, remember. These are the things that mattered. The only other actual individual behavior, the only other statistically significant out of all those 30 or 40 different indicators that predicted a difference was percentage of a county that smoked. That was the only other one. Yet Obamacare is designed to take very poor people and put them into an insurance system at a very expensive cost with the idea that it's somehow going to improve their health. But this research and years of research before it just show that that's absolutely not the case. So the fact that we're putting so much money into healthcare, and Ellen referenced it, and the speaker talked about our overall state budget, should worry us if you believe in the research and you believe that it's income and education that are actually driving the health of a state, and not how many people necessarily have insurance or have Medicaid.